Hello guys, my name is Dr. Wajid Khan. I am an anesthetist and intensivist. So we'll be dealing with this topic of anesthesia, right? Now we'll start with this topic of IV induction agents. In the IV induction agents, we are having 4 IV induction agents. We are having sodium thiopentone, we have propofol, we have ketamine, we have etomidate. Thiopentone, propofol, ketamine and etomidate. Now guys, whenever we are discussing about any drug, the first thing that we need to discuss about in any drug is what? We need to discuss about the introduction and pharmacokinetics. Introduction and pharmacokinetics. After that, we need to discuss about the effect of drug on various systems. Effect of drug on various system. Then we need to discuss about the contraindications. The first thing that we need to discuss is about the introduction and pharmacokinetics, right? So we are starting with this drug called as sodium thiopentone. Sodium thiopentone. How will you introduce sodium thiopentone? When anyone is asking you about the introduction of sodium thiopentone, you always have to get this picture in your mind. What picture, guys? This picture of sodium thiopentone. First of all, guys, sodium thiopentone introduction, what we need to write? Picture means what I am telling. Sodium thiopentone is a yellow amorphous powder and it is an ultra short acting barbiturate. It is available as a yellow amorphous powder and it is an ultra short acting barbiturate. So look over here, guys, we are talking about sodium thiopentone. In the introduction, what we need to remember, sodium thiopentone is a yellow amorphous powder and it is regarded as a ultra short acting barbiturate. Ultra short acting barbiturate. Why it is regarded as an ultra short acting? Why not long acting or why not long or intermediate? It is regarded as an ultra short acting barbiturate due to its rapid redistribution. Right? Sodium thiopentone is a yellow amorphous powder and important point over here is ultra short acting barbiturate. Why? Due to its rapid redistribution. The pH of sodium thiopentone is 10.5 and this sodium thiopentone was introduced by Dr. John Lundy. Right? This was regarding sodium thiopentone introduction. Basically, remember the most important points in introduction is it's a yellow amorphous powder and an ultra short acting barbiturate. Why it is an ultra short acting? It is an ultra short acting. Why? Because it's having rapid redistribution. Right? That was the introduction, guys. After introduction, remember guys, introduction and PK. PK is what? Pharmacokinetics. In the pharmacokinetics, what we need to remember? We need to remember DODE. D stands for dose of sodium thiopentone. O stands for onset. D stands for duration. And E is elimination T-half of sodium thiopentone. The dose of sodium thiopentone required to make any person unconscious is 3 to 5 mg per kg body weight. After giving this dose, within how many seconds the patient becomes unconscious? That will be the onset. The onset of sodium thiopentone, after receiving sodium thiopentone, within 11 seconds the patient is knocked out. It is the fastest acting IV induction agent. 11 seconds is the onset, hence it is the fastest acting IV induction agent. Dose is done, onset is done. One more D is duration. Duration. The duration of sodium thiopentone is 10 minutes. The patient will be unconscious for 10 minutes. Last is elimination T-half. How much time will it require for half of sodium thiopentone to get eliminated? It requires 10.4 hours. How many hours, guys? 10.4 hours is the time required for the elimination. So that is regarding the pharmacokinetics, dose, onset, duration and elimination, right? So introduction pharmacokinetics are done. Coming to the effects of sodium thiopentone on various systems. Many of the questions are being asked on this topic of effects of sodium thiopentone on various systems. We need to remember all, or we can remember all these effects by just remembering one line. By just remembering one line, all the MCQs regarding the effects will be covered. I used to remember that. What I used to remember is sodium thiopentone is best friend of CNS and enemy of other systems. Enemy of other systems. Sodium thiopentone is the best friend of CNS and enemy of other systems. When I am telling sodium thiopentone is the best friend of CNS, what does it mean, guys? What does it mean? When I am telling sodium thiopentone is the best friend of CNS, first of all, guys, with this one line, how you can solve most of the MCQs of sodium thiopentone, right? As I am telling it is the best friend of CNS, it will be used as an IV induction agent of choice for all CNS problems. Best friend yani ke it will be used as an IV induction agent. And it is enemy of all other systems, meaning what? It will be having contraindication to other systems. First of all, guys, remember what systems we need to talk about. We need to talk about the CNS, the respiratory, the cardiovascular, the muscle and the analgesia. CNS, respiratory, cardiovascular, muscle and analgesia. These are the systems. So I told you to remember in one line, sodium thiopentone is used, or sodium thiopentone is the best friend of CNS. Yani it is used as an IV induction agent of choice for all CNS problems. As it is an enemy of other systems such as respiratory, cardiovascular, muscle and analgesia, sodium thiopentone will be having contraindications to those systems. Sodium thiopentone will be having what, guys? Contraindications to those systems, right? So now we are discussing about this effects of sodium thiopentone. If you remember one line, you can easily remember most of the MCQs. Okay? Why? Because MCQ will be asking sodium thiopentone is contraindicated in. You have to remember it will be contraindicated. Contraindications come from the enemy yanake. It will be contraindicated to the diseases related to the other systems other than the CNS. Right? Now guys, we will replicate this thing into the systems. Sodium thiopentone, why it is regarded as the best friend of CNS? Reason is what, guys? Sodium thiopentone is regarded as the best friend. The reason being what? Guys, I told you it is not just a friend. It is a best friend. Just friend will have only one good quality. A best friend has unlimited qualities, but remember this sodium thiopentone, why it is best friend to CNS? Why? Because it is having three good qualities or three MCQ qualities on CNS, right? So sodium thiopentone is a best friend of CNS. Why it is a best friend? We are starting the CNS from here, guys. What it is doing to the CNS? Sodium thiopentone, what does it do to the intracranial pressure? If it is a friend, what will it do? It will reduce the intracranial pressure. As sodium thiopentone is reducing the intracranial pressure, it is used as an IV induction agent of choice. IV induction agent of choice in head injury and neurosurgery. In head injury and what surgery, guys? Neurosurgery. surgery, right? That is only one quality, but it is a just friend or best friend? Best friend. So other qualities of sodium thiopentone on CNS is what? Sodium thiopentone is having anti-epileptic properties. It is having anti-epileptic property. As it is having anti-epileptic property, it can be used as an IV induction agent of choice for epilepsy patient. For epilepsy patient. Third MCQ quality of sodium thiopentone is what? Sodium thiopentone can be used for narcoanalysis. Narcoanalysis or narco test or truth test, where you give patient sodium thiopentone, he goes into the subconscious state, you ask the patient anything, he will tell, 90% he will tell the truth only. But again, 100% surety is not there. Okay? So remember guys, it can be used for narcoanalysis. Three good qualities on CNS. One, it can be used for head injury neurosurgery as decreases ICP. Second, anti-epileptic property used for epileptic patients. Third, it can be used for narcoanalysis. Right? Next, coming to the enemies. Enemies of what system? I already told you. It is enemies to all other systems, respiratory, cardiovascular, muscle and analgesia. As it is an enemy of respiratory system, what will it do? Sodium thiopentone, will it cause respiratory stimulation or respiratory depression? It will cause respiratory depression. How? Sodium thiopentone releases histamine, causing bronchospasm, leading to bronchospasm, hence contraindicated in bronchial asthma. Sodium thiopentone releases histamine, leading to bronchospasm, hence contraindicated in bronchial asthma. Right? Next, what does sodium thiopentone do to the cardiovascular? Is it a friend or enemy? Again, it is an enemy. Enemy यानी कि contraindications. First, enemy means what will it do? Stimulation of the heart or depression? Depression. Sodium thiopentone decreases the cardiac output, thereby causing decrease in the BP. यानी कि sodium thiopentone causes hypotension. With hypotension, it causes tachycardia. With hypotension, it causes what, guys? Tachycardia. Sodium thiopentone causes hypotension and tachycardia. Right? Can you give sodium thiopentone to a patient who is in shock? No, sir. So again, cardiovascular system means enemy or friend. Enemy यानी कि contraindication. So hence it is contraindicated in shock as well as ischemic heart disease. Sodium thiopentone is contraindicated in shock as well as ischemic heart disease. So CNS is done, respiratory is done, cardiovascular is done. Coming to the next system, effect of sodium thiopentone on muscle. What is the effect of sodium thiopentone on muscle? There is no effect. Even though it's an enemy, but it has no effect, neither negative nor positive. Right? Analgesic property of sodium thiopentone. Is it a friend of analgesia or enemy? It's an enemy of analgesic system. Hence, sodium thiopentone causes no analgesia. There is no analgesia. Instead, the sodium thiopentone produces pain during injection. It produces pain during injection. There is no analgesia, instead it produces severe pain during injection. So this was regarding one line. Remember guys, one line of thiopentone is, it is the best friend of CNS, hence IV induction agent of choice for head injury neurosurgery, epilepsy and narcoanalysis. It is an enemy of other systems, first respiratory. As it is an enemy of respiratory, it is contraindicated in asthma. Next, it is an enemy of cardiovascular. As it is an enemy of cardiovascular, it is contraindicated in shock and ischemic heart disease. Next, it is an enemy of muscle, no effect. Last, analgesia. It is an enemy of analgesic system, yani ke there is no analgesia. Instead, it produces pain during injection. Instead, it produces pain during injection, right? Next, what we need to discuss, the last thing is about the contraindications. Two contraindications we can always tell. If anyone asks you about contraindications of thiopentone, your mind should go in that way and you have to think in that way. Contraindication means he is asking about the enemies. Who are the enemies of thiopentone? Respiratory, cardiovascular, muscle and analgesia. So contraindication come from the enemy. Sodium thiopentone is contraindicated in asthma, contraindicated in ischemic heart disease and shock. Apart from that, sodium thiopentone is also contraindicated in a person who is suffering with a disease called as acute intermittent porphyria. Acute intermittent porphyria. In acute intermittent porphyria, if you give sodium thiopentone, the porphyria gets worsened. There will be worsening of porphyria, right? So guys, we are discussing about what contraindications of thiopentone. It is contraindicated in shock, right? Apart from that, it is contraindicated in ischemic heart disease, right? Apart from that, sodium thiopentone is also contraindicated in porphyria. It is also contraindicated in acute intermittent porphyria. Acute intermittent porphyria. If you give thiopentone in a patient who is suffering with porphyria, the porphyria gets worsened. Why? Because thiopentone stimulates an enzyme called as ALA synthetase that will worsen the porphyria. Okay, so acute intermittent porphyria is a contraindication. Shock is a contraindication. Ischemic heart disease is a contraindication. Asthma is a contraindication. Bronchial asthma is a contraindication right there. Bronchial asthma is a contraindication. Last contraindication is never give thiopentone if you place a cannula in the cubital fossa. Never give sodium thiopentone if you are placing a cannula in the cubital fossa. Why, sir? Why? Because if you give sodium thiopentone, remember guys, why you never give is, if you place a cannula in the cubital fossa, there are some chances that your cannula from the vein might go into the artery. Imagine you have placed the cannula in the cubital fossa thinking that you are in the vein, but you were in the artery. If you place a cannula inside the artery and give thiopentone, yani basically if you give intra-arterial injection of thiopentone, what will happen? The moment you give that injection, patient will complain of severe pain in his hand. Patient tells the doctor, please stop, what you are giving, please stop. Why? Because sodium thiopentone, what does it do? As you are giving thiopentone into the cubital fossa inside the artery, it causes severe vasospasm that can cause that can cause ischemia and gangrene. Within no time, ischemia and gangrene can happen. Imagine guys, this scenario is happening with us. We have given thiopentone in the cubital fossa thinking we are in the vein, but we gave it in the artery. What will happen? Patient will complain of severe pain due to vasospasm, right? What will you do at that time? Will you remove the cannula which you have placed or will you keep the cannula? Remove or keep, guys? You will keep the cannula, not remove it. Even though it might be in the artery, don't remove it. You are given some thiopentone, don't remove it. What you need to do? Through that cannula, you can give some IV fluids so that you can dilute the effect of thiopentone. Through that cannula, you can give some vasodilators. Vasospasm has occurred, no? Vasodilators you can give. Right? Through that cannula, you can give lignocaine. Patient was having pain. But don't remove the cannula. If at all, after giving vasodilators also, you are suspecting that patient might develop gangrene, then what you need to do? Then you need to go for a stellate ganglion block. Stellate ganglion is responsible for vasoconstrictive activity of the upper limb. If you block the stellate ganglion, blood vessels will dilate, but that is the last option. That's the last option. So accidental, remember sodium thiopentone should not be given in the cubital fossa. Why? Because intraarterial injection chances are high. If at all intraarterial injection of sodium thiopentone occurs, then what is the next best management that we need to give? You leave the cannula on the site and then you give vasodilators, lignocaine, heparin if at all thrombus is being formed, but the last option is what? Stellate ganglion block. You can go for stellate ganglion block. That was regarding sodium thiopentone. Yes guys. So we have just completed sodium thiopentone. Coming to the next drug, which is called as Propofol. We are talking about the next IV induction agent, which is called as Propofol. So Propofol, remember guys, we are talking about the next IV induction agent called as Propofol. We are starting an IV induction agent. So what are the things that we need to remember? We need to remember the introduction in pharmacokinetics. We need to know the effects of drug on various systems, and then we need to discuss the contraindications. So first, starting with this drug which is called as Propofol, right? So Propofol, what's the color of Propofol? Propofol is a milky white solution. Why it is a milky white solution? It is not made up of milk. Propofol is made up of egg lecithin and soy. And as it is made up of egg lecithin and soy, easily it can get contaminated with bacterial. Bacterial contamination can easily happen with Propofol. Nowadays we are having newer preparations which are free from bacterial contamination. Nowadays we are having some. So Propofol is a milky white solution. Why? Because it is made up of egg lecithin and soy, right? And due to this presence of egg lecithin and soy, bacterial contamination can easily happen. Nowadays we are having preservative form of Propofol which prevents bacterial contamination. But again guys, the rule when you are using this milky white solution Propofol as an IV induction, the rule is what? Once you open the Propofol vial, you have to use it within 6 hours, right? Once the Propofol vial is open, you have to use it within 6 hours. So right there, the rule of Propofol usage is once the vial is open, use it within how many hours? Within 6 hours. If you take the same vial and use after 6 hours, bacterial contamination can easily happen. Why? Because it is made up of egg lecithin and soy. Okay, so that was the introduction of Propofol. The other name of Propofol is 2,6-diisopropyl phenol. Okay, that was the introduction guys. After introduction, we need to discuss about the pharmacokinetics of Propofol. Come on guys, in pharmacokinetics of Propofol, again we have to go for what? D, O, D, E. D is dose of Propofol. The dose of Propofol is 1 to 2 mg per kg body weight. That is the dose of Propofol. After giving this Propofol, within how many seconds the patient will become unconscious? That will be the onset of it. Onset of Propofol is 30 seconds. D is duration. For how much time the patient will be unconscious? The patient will be unconscious for 10 minutes. Almost all IV induction agents are having the same duration, 10 minutes. E is elimination T half of Propofol. Elimination T half of Propofol. The elimination T half of propofol is 10.4 hours. 10.4 hours. So once again guys, what we need to discuss in propofol pharmacokinetics is DODE. D is dose, O is onset, D is duration, and E is elimination T half. The dose is 1 to 2 mg per kg, onset 30 seconds, the duration is 10 minutes, and the elimination T half of propofol is 10.4 hours. 10.4 hours. That's the elimination T half of propofol. Now, elimination T half of thiopentone was 10.4 hours. So I repeat from here the elimination T half. The elimination T half of propofol is less than 2 hours. The elimination T half of thiopentone was 10.4 hours. Hence it was never used. Remember, as the elimination T half of thiopentone is 10.4 hours, we can't use thiopentone for daycare surgery. You know what is daycare surgery? Daycare surgery means surgery on the same day, discharge on the same day is called as daycare surgery. You can't use thiopentone for daycare surgery, but you can use propofol for daycare surgery. So that was regarding the introduction and pharmacokinetics of propofol. Once the introduction is done, then we need to go for what guys? After introduction and pharmacokinetics, we need to discuss about the effects of propofol on various systems. Effect of the drug on various systems. Now guys, remember, one line of thiopentone was what? Thiopentone was the best friend of CNS and enemy of others. Propofol is just friend of CNS and enemy of others. Just friend of CNS and enemy of others. Why it is a just friend? 3 qualities or 1 quality? Thio was the best friend of CNS, 3 qualities. Just friend, only 1 quality. Propofol decreases the intracranial pressure. Hence, it is the second best IV induction agent. Second best IV induction agent used for head injury and neurosurgery. Head injury and neurosurgery. Only 1 quality. Decreases ICP, hence it is the second best choice. Okay? Not any other quality on CNS. That's why it is just friend. Enemy of others means respiratory, it's an enemy. So, propofol also causes respiratory depression. Propofol also causes respiratory depression by inhibiting the protective airway reflexes. By inhibiting the protective airway reflexes. The protective airway reflexes. Propofol also causes respiratory depression by inhibiting the protective airway reflexes. Okay? But it is not causing bronchospasm. There is no contraindication in asthma, but you avoid in asthma, guys. Propofol you avoid in asthma. Next is cardiovascular. Cardiovascular, propofol and thiopentone has the same effect or similar effect. Thiopentone, what was it doing to the cardiovascular? Thiopentone, propofol, both are reducing the cardiac output, thereby causing hypotension. So both causes hypotension, but the differentiating feature between propofol and thiopentone is what? Propofol causes hypotension and bradycardia. Hypotension and bradycardia. Right? Propofol causes hypo and bradycardia, whereas thiopentone was causing, remember guys, thiopentone was causing hypo and tachycardia. Sometimes in exam we forget what is causing both are causing hypotension, that we can remember. But we forget who causes hypo and tachy and who causes hypo and brady. Remember guys, remember just thiopentone, it causes hypotension and tachycardia. T for thiopentone, T for tachycardia. But again, primarily what are they? Both causing hypotension. Hence it is anemia also. So as it is causing hypotension, can you give propofol in shock? No. Same like thiopentone, it's having same contraindication. It is contraindicated in shock as well as ischemic heart disease. It is contraindicated in shock as well as ischemic heart disease. Coming to the next system, what is the effect of propofol on muscle? Same like thiopentone, there is no effect. It has no effect on muscle, there is no effect. What is the last system? Analgesic property, again same like thiopentone, there is no analgesia. Instead, propofol also produces pain during injection. It also produces pain during injection. So propofol has no analgesia and it also produces pain during injection. That is the effect of propofol on various systems of the body. That's the effect of propofol on various systems. So remember guys, thiopentone, if you remember thoroughly, propofol will be a cakewalk. Benchmark of IV induction agent, you have to remember thiopentone. Propofol, remember thiopentone was best friend of CNS, enemy of others. Propofol is just friend of CNS, enemy of others. Right? Coming to the contraindications. If anyone is asking you about contraindications, you always have to look about what? Contraindication come from the enemies. Enemies means respiratory. Propofol is not contraindicated in asthma, but it is avoided in asthma. Okay? Next system, what we need to know is propofol cardiovascular. What is the effect of propofol on cardiovascular? Propofol is contraindicated in shock as well as ischemic heart disease. So we can easily remember this contraindication. But one extra contraindication which we need to remember is propofol is contraindicated as a long-term infusion. Never give propofol as a long-term infusion. Imagine a patient is there who is in ICU. He is on ventilator and you want to sedate him for a long time. For long-term ICU sedation, you can't give propofol, you can't give any IV induction agent. If it was long-term operation theater sedation, you might have given inhalational agent for long-term sedation. But for long-term ICU sedation, you can't give any IV induction agent. Especially propofol is contraindicated. It was seen that propofol, if you give for more than 48 hours as an infusion in children, it will land up the child into a syndrome which is called as what? Propofol infusion syndrome, where there is failure to metabolize the free fatty acids. So remember guys, this propofol cannot be given as a long-term infusion. If you want to sedate the patient for a longer time, instead of propofol, you can use what? Instead of propofol, you can use fentanyl or midazolam. I personally used fentamidaz infusion. Fentanyl midazolam infusion. So remember guys, we are talking about what? Propofol. Propofol contraindications. In what conditions is propofol contraindicated? Propofol is contraindicated in shock. Propofol is contraindicated in ischemic heart disease. Why, sir? Why? Because propofol is causing hypotension and bradycardia. Hence it is contraindicated. Apart from that, the third contraindication is it is contraindicated as a long-term infusion. If you give propofol as a long-term infusion for more than 48 hours in a child, the child will land up into a syndrome called as what? Propofol infusion syndrome, where there is failure to metabolize the free fatty acids, right? So that is regarding the propofol contraindication. So remember, if at all you want to sedate the patient in ICU, what we can give for long-term ICU sedation, we can give a combination, guys. For ICU sedation, we give a combination which is fentamidaz infusion. What is this fentamidaz infusion? Fentanyl and midazolam infusion. Fentamidaz infusion is what, guys? injection of fentanyl and injection of midazolam, you prepare it in a combination and you give it to the patient. Patient will be sedated for a long time. Okay? That's regarding propofol. That's regarding propofol. Okay? Coming to the most important points of propofol, without which if you haven't discussed that, you haven't discussed anything about propofol. The most important points of propofol is, tell me the conditions where propofol is used as an IV induction agent of choice. In day case surgery, it is an IV induction agent of choice. Why? Why? Because it's having a short elimination T-half. In acute intermittent porphyria, thiopentone is contraindicated and propofol can be given. Basically, remember, in acute intermittent porphyria, almost all are avoided. Contraindicated is thiopentone, but the safely given IV induction agent in porphyria like condition. Remember guys, porphyria starts with P, propofol also starts with P. So you need to remember propofol for porphyria, right? So we are discussing about 5 conditions where propofol is used as an IV induction agent of choice, right? What are the 5 conditions where propofol is used as an IV induction agent of choice? Very, very important guys. The 5 conditions are, the first condition you can mark there, it is used for day case surgery. Second condition is, it is an IV induction agent of choice for acute intermittent porphyria. Acute intermittent porphyria. The third is what? Propofol is an IV induction agent that has antiemetic property. Propofol is an IV induction agent that has having what property? Antiemetic property or antipruritic property is seen with propofol, right? So whenever the patient is having recurrent nausea, vomiting like things, you can give propofol as an IV induction agent that prevents nausea and vomiting, right? Next, the fourth point of propofol is what? Propofol can be used for LMA insertion. Propofol can be used for LMA insertion. What is this LMA, guys? LMA is laryngeal mask airway. Laryngeal mask airway. What is this laryngeal mask airway? Laryngeal mask airway is a temporary airway device. It is commonly used when you are not able to intubate the patient. If you fail in your intubation, you go for bag mask ventilation. If you fail for bag mask ventilation, you go for a temporary airway device which is called as what? Laryngeal mask airway. For insertion of that laryngeal mask airway, propofol can be used as an IV induction agent. So once again guys, propofol is used as an IV induction agent of choice in 5 conditions. First, day case surgery. Second, porphyria. Third, LMA insertion. Fourth, it is having antiemetic property. Last, propofol can be used as a component of TIVA. Propofol can be used as a component of TIVA. What is TIVA, guys? TIVA is total intravenous anesthesia. What is this total intravenous anesthesia? It is a general anesthesia only. In general anesthesia, we use combination of drugs, IV agents and inhalational. TIVA is giving general anesthesia without using inhalational agents. So you can say TIVA is general anesthesia without inhalational agents. General anesthesia given to the patient without using inhalational agent is called as TIVA, total intravenous anesthesia. So once again, these 5 points of propofol are damn important. Where is propofol used as an IV induction agent of choice, right? Next, coming to the next drug which is called as ketamine. Once again guys, we are starting with the drug called as ketamine. So what we need to discuss? We need to discuss the introduction, pharmacokinetics, effects of the drug on various systems and contraindications. Ketamine introduction. What we need to write in the ketamine introduction? Ketamine is a phencyclidine derivative. Ketamine is a phencyclidine. Ketamine is a, you can repeat it. Ketamine is a phencyclidine derivative and NMDA receptor blocker. NMDA receptor blocker. Ketamine is a phencyclidine derivative and an NMDA receptor blocker. Coming to the pharmacokinetics of ketamine, guys. Coming to the pharmacokinetics of ketamine. In the pharmacokinetics, again, we have to remember what? DODE. D is dose, O is onset, D is duration, and E is elimination T half of ketamine. Elimination T half of ketamine. The dose of ketamine is similar to Propofol, 1 to 2 mg per kg body weight. Onset after giving ketamine, within how many seconds the patient becomes unconscious? It is 30 seconds. 30 seconds the patient becomes unconscious. Within 30 seconds patient is unconscious. D is duration. The duration of ketamine is, it works for all IV induction agent works for 10 minutes. So ketamine we were discussing. Ketamine pharmacokinetics, I told you the duration is 10 minutes. Elimination T half of ketamine is 3 to 6 hours. 3 to 6 hours. Elimination T half of thiopentone was 10.4 hours. Elimination T half of thiopentone was 10.4 hours. Elimination T half of propofol was less than 2 hours. Whereas ketamine elimination T half is 3 to 6 hours. Right? Now, introduction pharmacokinetics के बाद में what we need to discuss? We need to discuss the effects of ketamine on various systems. When we are discussing the effects of ketamine on various systems, we have to remember in one line regarding the effects. What we need to remember, guys, ketamine is what to the CNS and what to the other systems. Ketamine is regarded as the worst enemy of CNS and friend of other systems. And friend of other systems. Basically, I can say ketamine is total opposite of thiopentone. Thiopentone was the best friend of CNS and enemy of others. Ketamine is not the best enemy, it is the worst enemy of CNS. Now there is a difference between enemy and worst enemy. Again, an enemy will have one bad quality, worst enemy has many bad qualities. Okay? Why it is having, why am I telling ketamine is the worst enemy of CNS? Why? Because what will ketamine do to the CNS? Ketamine increases the intracranial pressure. As it is increasing the intracranial pressure, can you give ketamine for a head injury or neurosurgery? No. It is contraindicated in head injury and neurosurgery. Head injury and neurosurgery. Next, ketamine not only increases ICP, it also increases IOP, intraocular pressure. Hence, contraindicated in glaucoma. Hence, it is contraindicated in glaucoma. So, two contraindications we have discussed. Remember, it is the worst enemy of CNS means all contraindications of ketamine, almost all contraindications come from the CNS. It increases the IOP, hence contraindicated in glaucoma. Ketamine causes epilepsy. It causes epilepsy, hence contraindicated in epileptic patients. Hence contraindicated in epileptic patients. Last, ketamine causes hallucinations. Ketamine causes hallucination. Come on guys, you might be knowing what is hallucination. Hallucination is false perception of anything is called as hallucination, right? But you might be wondering, when does the ketamine cause hallucination? When does the ketamine cause hallucination? Ketamine is an IV induction agent. It makes the patient unconscious. When will it cause hallucination? It will cause hallucination as the patient is recovering from the effect of it. Patient will have hallucinations. But guys, remember, ketamine is causing hallucinations. Hence, it is contraindicated in patients suffering with psychiatric illness, especially schizophrenia. In schizophrenia, patient will be having hallucination, right? So now guys, remember there was one of my junior. We had this habit of like we usually teach the juniors and all, but at times we pull their leg also. So what we did is, one of the junior, he joined the department after 1 or 2 months. There was a a lady posted for DNC, dilatation and curettage, under short sedation. Short sedation means what, guys? You give a little dose of propofol and a bit of dose of ketamine and the patient becomes unconscious. The surgeon will finish the surgery, right? So basically, we gave ketamine. We gave a vial of ketamine to the junior and we told that give ketamine to the patient. That junior, he gave ketamine to the patient. Patient became unconscious. Surgeon did the surgery. And after the surgery was done, the patient was now recovering from the effect of ketamine. So as the patient was recovering from the effect of ketamine, this patient was constantly staring at this junior. And this junior was blushing. And it was not a normal stare. It was basically, you guys can understand what kind of stare, right? She was staring, she was smiling at the junior and this junior was blushing, right? And slowly, and in the next moment she told what? Doctor, your hair is very nice. Doctor, your eyes are very nice. The patient was telling, and this junior was blushing more. We slowly told this junior what? Bhai, it is not the patient who is talking to you. It is basically the ketamine who is making the patient talk to you in this manner. Right? So ketamine produces hallucination as the patient is recovering. The patient will have not only hallucination, some of the patient will have delusion. Some of the patient will have nystagmus. Nystagmus is to and fro movement of the eyeball. Some of the patient will have confusion. Some of the patient will have fear. All these reactions are called as emergence reaction. All these things are called as emergence reaction. So as the patient is recovering from the effect of ketamine, patient will have emergence reaction, right? So it is avoided in the patients who are suffering with schizophrenia. It is contraindicated in schizophrenia. So remember, it's a worst enemy of CNS, friend of others. As it is a friend of respiratory, what will it do to the respiratory? Friend hai, so what will it do? Ketamine causes bronchodilation. Ketamine causes bronchodilation. Hence, it is the IV induction agent of choice in asthma. IV induction agent of choice in bronchial asthma. Come on guys. Friend of other system means it will be used as IV induction agent of choice for all other systems. Hence it is the IV induction agent of choice in asthma. Next system. What will ketamine do to the cardiovascular system? Friend or enemy? Friend. So ketamine, what will it do to the cardiovascular system? Ketamine increases the cardiac output, thereby increasing the BP and pulse rate. Hence, it is the IV induction agent of choice in shock. IV induction agent of choice in shock. Apart from shock, it is also IV induction agent of choice for cyanotic heart disease, such as tetralogy of Fallot, but it is still contraindicated in ischemic heart disease. Why? Because I told you guys, ischemic heart disease patient cannot tolerate extreme changes of the blood pressure and pulse rate. What is ketamine doing? Ketamine is suddenly increasing the BP and pulse rate. Hence, ketamine is contraindicated. How about propofol? Can you give propofol in ischemic heart disease? No. Why? Because propofol is suddenly decreasing the BP, whereas thiopentone is also suddenly decreasing. So all in all, neither you give ketamine, nor you give propofol, nor you give thiopentone in ischemic heart disease. The only IV induction agent that could be safely given in ischemic heart disease is what? We are left out with Etomidate. That is the most cardiostable IV induction agent. We'll discuss that later, okay? So anyways, next. What is the effect of ketamine on muscle? Ketamine increases the muscle tone. Ketamine increases the muscle tone. Last is the analgesic property, guys. Analgesic property. Friend hai enemy hai? It is a friend. So what will it do? Ketamine produces good analgesia, and there is no pain during injection. There is no pain during injection. It produces good analgesia and there is no pain during injection. That's regarding ketamine. The effects of ketamine on various systems. Remember, ketamine is the worst enemy of CNS. All contraindications of CNS and friend of other systems. IV induction agent of choice for other system except for ischemic heart disease. Except for ischemic heart disease. But it can be given in, it's the IV induction agent of choice in shock and cyanotic. Now I told you guys, when will the patient have hallucinations after receiving ketamine? The patient will have hallucinations during what? During recovery. During recovery, the patient will have hallucination, delusion, nystagmus, confusion and fear, right? This is called as what reaction? Emergence reactions. Hence, due to this reason, ketamine is contraindicated in schizophrenia. Ketamine is contraindicated in any psychiatric illness. Any psychiatric illness, you never give ketamine. You never give ketamine. Other contraindications. Now we are going for the contraindications. You guys know, if any one of your friend asks you about contraindications of ketamine, immediate answer should be what? All contraindications of ketamine come from the CNS. Contraindicated in head injury, neurosurgery. Contraindicated in glaucoma. Why? It increases the intraocular pressure. Contraindicated in epilepsy. Contraindicated in, come on, epilepsy, apart from epilepsy, it is also contraindicated in what, guys? Contraindicated in schizophrenia. So these are the contraindications. Last contraindication is it is contraindicated in ischemic heart disease. It is contraindicated in ischemic heart disease. These are the contraindications of ketamine that we need to remember. This is regarding ketamine, guys. This is regarding ketamine, right? Coming to the last IV induction agent, which is called as Etomidate. Which is called as what, guys? Etomidate. Etomidate, what we need to remember, Etomidate is the most cardio-stable IV induction agent. When do you call an IV induction agent as cardio-stable? Any IV induction agent that does not cause any problem to the BP and pulse rate, neither increases nor decreases the BP, neither increases the pulse rate nor decreases. Cardio-stable means an agent that maintains the BP and pulse rate. Agent that maintains the BP and pulse rate is called as cardio-stable. Etomidate is the most cardio-stable IV induction agent. Why? Because it maintains the BP and pulse rate. Hence, it is indicated for what diseases? Hence, it is indicated for any cardiac diseases. Etomidate is indicated for any cardiac diseases. But Etomidate is having one good point, guys. Rest all are the bad points of Etomidate. Starting with what? As you are giving Etomidate to the patient to make him unconscious, the patient will have pain during injection. But is it a new thing for us? Propofol is also painful, thiopentone is also painful, Etomidate is also painful. The only painless IV induction agent was ketamine. Only painless IV induction agent was ketamine. So anyways, guys, what we need to remember is Etomidate is the most cardio-stable IV induction agent. That is one good point, which is indicated for cardiac disease. But the bad points of Etomidate is what? Etomidate is a painful injection that causes nausea and vomiting. Etomidate is a, mark this as a second point, it is a painful injection that causes nausea and vomiting. The IV induction agent that was preventing nausea and vomiting was Propofol. The IV induction agent that causes nausea and vomiting is Etomidate. Apart from that, you can never give Etomidate as a long-term infusion. Propofol, if you give as a long-term infusion, patient will end up into propofol infusion syndrome. Etomidate, when you give as a long-term infusion in ICU patient, it will inhibit an enzyme called as 11-beta hydroxylase, leading to adrenal suppression, which will worsen the patient's health, right? So etomidate, long-term infusion should be avoided. Long-term infusion of etomidate can cause, this is the fifth point, you have to mark in this fashion. Long-term infusion of etomidate can inhibit an enzyme 11-beta hydroxylase, leading to adrenal suppression. Right? So guys, remember regarding etomidate is the most cardiostable IV induction agent indicated for heart disease. Why? Because it has no problem. It does nothing to the heart. It does nothing to the BP and pulse rate. It maintains the BP and pulse rate. But the bad points of etomidate, it's a painful injection causing nausea and vomiting, and when you give as a long term, it will inhibit an enzyme called as 11-beta hydroxylase that causes adrenal suppression that leads to deterioration of the patient's health or worsening of the patient's health. Right? So this was regarding the IV induction agents. Okay guys, this was regarding the IV induction agents. Thank you guys.